Okay, so my name is Mr. Hove. I'm from Bluefin Vision. Today we're talking about LASIK, which is or lenticular extraction. Why? Well, patients sometimes get in touch with us saying, should I be having LASIK or should I be having lenticular extraction? Lenticular extraction is a newer procedure, or which one would be more appropriate? And so I thought I'd do a short video explaining each and why we do different procedures for different patients. So first and foremost, laser eye surgery, which is what most patients are referring to when they talk about LASIK. That's a procedure where we correct your refractive error by cutting a thin flap, it's 100 microns, in the cornea, lift that flap up, and then reshape the underlying stroma to get rid of your refractive error. It works really, really well. We've been doing it for the best part of 30 years. You see quite well the next day, so generally you can see fantastically well the next day, and it's got a fantastic track record. In the last 5 years, lenticular extraction has come to the fore. And lenticular extraction corrects your refractive error in a different way. It corrects your refractive error by removing a thin sliver of corneal stroma from the eye. The two main companies that provide the laser machine for lenticular extraction are Zeiss, and they do a procedure called SMILE, and Schwind, and they do a procedure called SmartSight. So if a patient is asking for either SmartSight or SMILE, what they're effectively asking for is lenticular extraction. And I'm definitely referring to today as lenticular extraction because I'm not trying to advocate for either company, even though both companies make fantastic machines. So with lenticular extraction, the difference being is that because you're extracting a small sliver of the stroma through a tiny window in the cornea, you don't create a corneal flap. And for people that are active sports people, like rugby players, karate, jiu-jitsu, those type of players, where there is a possibility that it could be scratched or poked in the eye, and therefore the flap that was created with LASIK could get damaged or disrupted, then lenticular extraction offers a fantastic solution because effectively there is no flap. The procedure is just as quick as having LASIK, but it's slightly different in the sense that the patients who have lenticular extraction often find that their vision recovers well over the first few days, but it takes about 1 to 2 weeks to get the full maximal benefit in terms of how them seeing clearly. So with LASIK, you see quite well, pretty much 20/20 or better the next day. With lenticular extraction, it takes a little bit longer for your vision to become very clear. Some patients achieve that after 1 day, but most patients take a little bit longer. Both patients with lenticular extraction, it's supposed to cause less dry eyes, but the evidence is equivocal. I don't really advocate one or the other based on the dry eyes. So both procedures are fantastic to have. Often I'm guided by which procedure the patient wants to have. Also worth mentioning is that the top-up treatment that you might need to have. So if I explain a little bit about that, when you're doing laser eye surgery, the aim is to do one laser eye surgery procedure which corrects your full prescription in one go. But realistically, 2 to 3 to 4% of patients sometimes need to have a bit of enhancement. You do the laser procedure, you go from -8 to -1, and then we need to go back and do a bit more laser to get rid of that leftover prescription. Now, if you have LASIK, it is very easy to lift up the flap, do a bit more treatment to put the flap back down. Whereas when you have lenticular extraction, the correction of those patients is slightly more tricky because sometimes you end up having to create a flap to correct the patient. So my preference in terms of just ease is if patients' prescriptions are less than 5, I'm quite happy to do either or. But once they tend to get to higher prescriptions, my preference is to do LASIK as opposed to lenticular extraction, only because those are the patients who typically are more likely to need to have enhancement, and enhancement is relatively easy if I perform LASIK as opposed to lenticular extraction. But I'm comfortable doing either procedure. If you're interested in either, please contact Bluefin Vision. We will be happy to guide you on your journey to clearer sight. Thank you.